September month of every year is being conducted as a childhood cancer awareness month. It's about 50,000 children are diagnosed with childhood cancer in India every year. This is a small number compared to an adult cancers, which are about 1.4 million. The childhood cancers are different from the adult cancers because they are not lifestyle related, they are not related to the environment. Very few childhood cancers are because of the genes passed on from the parents, but majority of them are not. So the childhood cancers, better they looked after in a specialized center which caters for the needs of children with cancers. So there are some few symptoms which the parents needs to be aware when to consider the possibility of childhood cancer. For example, any child having fever for more than 3 weeks and there is no reason found, cancer should be considered as one of the possible reasons. And if the child has unnecessary or unusual swelling in the joints which is not resolving, or if the child has got easy bruising or the color is low, severe headaches which are progressing and not getting better with vomiting, or any unusual change in the posture of the child or walking, and any bruising, bleeding, all those things, the cancer should be considered as a possible diagnosis. About 1/3 of childhood cancers are leukemias, which are blood cancers, and about 1/4 of childhood cancers are brain tumors, and all the other solid tumors make up the rest. When the child is suspected of cancer, first step is to make the diagnosis, confirm the diagnosis, and then plan the treatment.
As a surgeon, I deal with the solid tumors. 45% of the cancers are related to the blood cancers in children, which may or may not be connected to the genetics or inheritance. But most of them, they arise from the embryonal tissue. That is what we call it as a solid tumors. These tumors are most commonest are in the brain, that is around 24%. 7 to 8% they are arising from the adrenals, that is suprarenals, and 6% from the kidney, that is called as a Wilms tumor. Other tumors arising from the lungs, from the liver, from gonads are also there, but they are very rare. But most common are the abdominal tumors. Since most of the tumors are happening in the age group of under 5 years, it is very difficult for the parents to know the symptoms since the child is just starting to understand or starting to talk. So parents have to be very careful about the initial symptoms where there is a loss of weight, refusal to feed, the child becomes suddenly inactive, there is persistent headache, visual disturbances, or any convulsions. One needs to be diagnosed early because in early phases, if this is diagnosed and treated, the outcome is much better as compared to the adult malignancies. There are various modalities of diagnosing: a simple ultrasound or MRI, PET scans, which can be done at higher centers who are dealing with the childhood cancers and which has experts to deal with it. It can be dealt by doing simple surgeries or chemotherapy, or sometimes maybe radiotherapy is also available in these cases. So I request most of the parents who have children who are having abnormal behavior suddenly, who are doing good in their life, to look into this so that we can detect these cancers in early stages and can be treated appropriately to get good results.
The commonest cancer in children is leukemias. Most of them are treated with just chemotherapy and most of them do well. The second group of tumors which are common in children are the brain tumors. The brain tumors, most of them will need neurosurgery and some of them will need radiotherapy and chemotherapy. And the third group of tumors in children are what we call the solid tumors. This is a combination of lymphomas which are again treated like leukemias only with chemotherapy, and the other solid tumors are abdominal tumors like Wilms tumor or neuroblastomas. These some need surgery, chemotherapy, and sometimes radiotherapy as well. There are other tumors like bone tumors, which are osteosarcoma or Ewing sarcoma. They usually happen in older children like adolescents, and they will need chemotherapy to reduce the size of the tumor. And we do something called limb salvage surgery, where we are able to salvage the limb and only remove the cancer. And for some of them may end up needing radiotherapy. There are other group of soft tissue tumors called rhabdomyosarcoma, which happen in the soft tissues. They can happen anywhere in the body, and again most of them will be cured with combination of chemotherapy and surgery, and some of them may need radiotherapy as well. Overall, the cure rates in cancer in children are very good, and we expect to cure anywhere to 70 to 80% of the children with cancer, And in some cancers, especially cancers like good risk leukemias, Hodgkin's lymphomas, Wilms tumor, the cure rates can be as high as 90 to 95%. I think the most important thing is to recognize the cancer in the early stage. This is usually done by the pediatricians, and then referral to the right center so that they get the right treatment, and also to increase the availability and accessibility of cancer treatment to all the children.